afternoon. This is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 FM for its live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission is to change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which options might work in their case. And if you feel you're stuck in a dark place, I want to tell you there is a light at the end of the tunnel. Today I am with Dr. Glenn Guilderson, my personal chiropractor and the owner of Back to Health Chiropractic in Sackville Drive. Welcome to my show.
Hello, Christine. Thanks for having me here.
Let me briefly share my own experiences with chiropractic.
Of course.
When I came to Canada 20 years ago, I was very sick. My back was really bad. So I heard of the great chiropractors in Canada, and my doctor recommended a chiropractor. I went to him. I won't mention any names. I could hardly walk out after the treatment. So I said, maybe that's not the right thing for me. I was very disappointed. A year later, I tried another chiropractor. Won't mention any names. This time I could walk out, but it didn't get better and I didn't see the way. So what happened? I went to the pain clinic. I got epidural steroids for 10 years. Got osteoporosis from that and decided that's not the way to go.
Right.
I got recommended to your office, and it was 2012. At this point, Dr. Jessica Boudelier was working for you. Pelletier. Sorry, Dr. Jessica. She's now in Fall River, great chiropractic lady.
Yeah.
And she started me on the way of chiropractic. She was gentle, sent me for x-rays, was very careful not to aggravate it, and it slowly and regularly with chiropractic got better. When she left for Fall River, I came to you, and I'm since with you, and I must say, I come every 2 weeks now, and my back is good. Mm-hmm. So I personally can recommend chiropractic for back pain, but you have to find a good one, or the right one for your
That's a better way to put it. Yeah, the right one for you.
So let me ask you a question. How did you decide to become a chiropractor?
Oh, my own experience was, it started when I was quite young. I can remember my father throwing out his back and or slipping a disc. I remember something vague like that. It was described to me that, he couldn't go to work, couldn't walk. So he went to his family doctor and was prescribed aspirin and bed rest, which was a very common recommendation in the 1970s. And it didn't work, so he went back to his doctor and said, what can I do? And the doctor said, just go back, more Advil, or not Advil, not in those days, aspirin and bed rest. Still didn't work. And he had friends, coworkers who were getting better, who had the same kind of problems by seeing a chiropractor. We lived in the South Shore, we lived in Liverpool, so he drove to Bridgewater, saw a chiropractor there, and got better. That was my first experience, but I was a very young boy at the time.
How old were you then?
I was probably 6 or 7 years old. Right, yeah. Then much later, living here and growing up in Beaverbank, my practice is in Lower Sackville, so I haven't moved that far away really. But my mother was having frozen shoulder problems. So I was 18 now, and she was seeing a chiropractor in Sackville. And I was saying, this is great, Mom, it worked. But question, why are you still seeing the chiropractor? You don't hurt anymore. So why do you still go once a month?
Good question.
And Mom was saying, because it's not just my shoulder that feels better, it's everything. I don't feel hunched over, my breathing's better, other joints don't ache, and my curling game has gone way up. I'm so much better at that now, too. So she was finding it for athletic performance enhancement as well. So I went in with a skeptic's mind. I went there and met the chiropractor. I still know the guy. He's a good friend of mine now. We're colleagues, of course. And And he opened my mind to it because he showed me that he wasn't just helping her with a certain symptom. He was helping her whole nervous system work in the way it was designed to. Better communication from the brain to the body, through all the muscles, through the nerves. And my mother has never stopped seeing a chiropractor. I'm now her chiropractor, as are I have two colleagues who work with me, and they've also been helping my mother stay in great alignment all these years. And she's still in her 70s now, and she still plays curling several times a week. She lawn bowls all summer long. She's in excellent health, and that is when I start seeing a chiropractor as well. So I've been, not only did I become a chiropractor, I also at that moment became a chiropractic patient too. So that was my mother was a big influence that way too.
Wow, that is an amazing story. I would like to know a little bit. Many people don't know really what a chiropractor has to do to become a chiropractor. They think,
good question.
oh, well, all they do is crack the joints, but that's not really what a chiropractor does.
Not really at all.
So tell me a little bit about what you had to do to become a chiropractor.
And we also don't get our diploma in a Cracker Jack box either. No.
That's good.
No, so to become a chiropractor, I was halfway there by the time I started seeing a chiropractor, because I already thought I wanted to be either a medical doctor or a dentist until this eye-opening experience was, this is the right career path for me, is to become a chiropractor. So I went to Dalhousie for 6 years. I got my bachelor's degree with an undergrad advanced major in biology. And then after that, I went to Toronto. That's where the chiropractic school is. And that's another 4 years on top of that. So for myself, it was 10 years of university and graduate level study.
So you have a hefty science background.
Oh, extremely, yes. It's the same exact level of training you would need to get to become a GP or a dentist or an optometrist for that matter.
So is that every chiropractor has to have that?
Yes, every chiropractor has to have that, and even from other countries. Let's see, I remember my school, there was an exchange student from Japan. Chiropractic is popular there too. There are chiropractic schools in Australia, New Zealand. There's chiropractic schools in Europe, in England. In Canada, there are only two, one English-speaking in Toronto and one French-speaking in Quebec. And in the United States, where chiropractic started, there are at least a dozen or more chiropractic schools, including the first one, the one in Davenport, Iowa. It's still there today, and it was founded by the first chiropractor, Dr. Daniel David Palmer in 1895.
Yeah, I've heard of him. That was one thing when I joined your practice. I got a little book about chiropractic and the history. That was so interesting.
Good. You learned a little bit of the background, right?
I sure did. So maybe tell our viewers a little bit about the history of chiropractic.
Oh, sure.
Many people don't know that it's really an old science.
Yeah, and even older than 1895. There's who's the most famous Greek physician, Hippocrates, who invented the Hippocratic Oath. He also is very famous for the quote, "Look to the spine for the cause of disease." He believed,
and the gut.
And the gut. Yes, you will probably mention that in one of your future episodes, right?
Yes.
The gut microbiome, right?
Exactly.
Yes. So what was at the time, the 1800s, Daniel David Palmer, or D.D. Palmer as he was called, he was professionally trained as an osteopath at the time, and he was also using magnets to try to help people heal, and he was disappointed with the progress he was receiving with his patients. And looking at anatomy textbooks, he was starting to realize that it's not just the blood that is about healing, it is the nervous system. So the story is, this is the legend, how it goes, is that he called out to his janitor, "Hey, Harvey Lillard was his name, could you lay on this table? I'm going to try something on you." And his janitor gladly volunteered, I suppose. His janitor was deaf since he was kicked by a horse at the age of 4 years old. So legend has it that when D.D. Palmer checked his spine and corrected its alignment, Harvey could get off the table and then hear again.
Wow.
And that's how chiropractic started. Yeah.
Wow, that's amazing.
Yes. His son, B.J. Palmer, then is the one who is responsible for expanding the knowledge of chiropractic.
Yeah.
And he actually opened his own radio station.
Wow.
Yeah, in the chiropractic school, to not only just promote chiropractic, but also just to spread the word about natural health.
So that's how the whole thing started, when medicine was still, the conventional medicine was still in its baby shoes.
Oh,
yes,
absolutely.
There was a lot, but the modern science was in its baby shoes, and Charles Darwin was just with the evolution, and Freud and Sigmund Freud in Germany was just working in, and so it was and mesmerizing. So that's quite interesting.
Quite a time in history, isn't it? I mean, in those days, medicine was still using cocaine as a
local anesthetic for the eyes. Yeah, very interesting how they used it, and all kinds of stuff that nowadays, heroin for pain and everything. That history of medicine is very interesting. I hope I can talk about that sometime. Now, tell me a little bit more what differentiates a chiropractor from a conventional doctor and an osteopath.
Oh, okay. Let's see. A chiropractor. So our expertise is, of course, checking the spine. Okay, we can identify joints in the spine that have restricted movement or poor alignment. This is important to identify because if this is the case, the nervous system doesn't work as well as it was designed to. Signals from your brain can't properly transmit. You have nociception stimulation, which then leads to the perception of pain. So if you can improve the movement and alignment of the joints of the spine, it takes the irritation off the nerves, and facet joint inflammation decreases. You have pain relief, but you also have other improvements as well, because you can literally measure someone's blood pressure before and after. You can measure their heart rate. You can measure their breathing. Many things, many organs improve as well when you have a healthier functioning nervous system. Osteopathy, they try to go more directly to the organs themselves. So they may try to help someone's liver, not by work on the nerves that go to the liver, but actually by palpating the liver itself and improving its function by work on the fascia around the liver.
Oh, wow. So they work with the fascia. I didn't know that.
Right. And then whereas a chiropractor, where we are the experts of the spine, from C1 to L5 and the SI joints, they like to work on the bones of the cranium and the bones of the sacrum, like the actual fused bones and the fused bones of the skull. They work with they're not completely fused. They work with those, what do they call it? The sutures. Right. Especially my wife, she's an osteopath, and her favorite aspect of osteopathy is what's called cranial sacral therapy. And that's what I'm referring to when I'm describing the cranium and the sacrum.
Okay, right. So that's very interesting. And with that, we'll stop the first half of the episode and of today's broadcast on 97.5 COE FM Community Radio. And please tune in after the commercial break for more with Dr. Glenn Guilderson. Thank you. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm here with Dr. Glenn Guilderson, the owner of Back to Health Chiropractic in Sackville. In the first half, we talked about why you became a chiropractor, what a chiropractor does, and what education they have to have, and a little bit about the history. That is really interesting. In the second half, I'd like to talk a little bit more about the details of who chiropractic care benefits the most. Are there certain diseases or problems, or who should come and see a chiropractor?
Okay, that's a great question. So some of the things that we're most well known for are, I guess you could divide the body into two halves. We're known for neck pain, shoulder pain, and headaches. Then we're also known for back pain, hip pain, and sciatica. So to start with the first half of the body, the neck pain, shoulder pain, and headaches, these are suffered by many people. Our techniques are safe, gentle, extremely effective as well. And there are different ways that we can help somebody with these conditions. Yeah. So, for instance, often neck pain, shoulder pain, and headaches come from the same areas, from the neck, from the cervical spine. Now, as a chiropractor, I'm trained to very safely do methods that adjust the joints of the spine if they need it. So if we find a restricted joint, the benefit to having it move properly again are that the nerves work better. Or a joint that is not lined up properly, to get it lined up better, the nerves become healthier then. This may lead to patients not having headaches anymore ever again. I have a patient who had migraines 3 times a week since she was 16 years old, and she saw me when she was in her 40s. And I've been seeing her headaches, her migraine stopped the moment I started adjusting her neck, and she's never had another migraine in her life.
Wow, that is amazing. And I
I've
can
known her
share
for 8
one
years
thing.
now. Yes.
I had since 1984, I continually had neck pain.
Yes.
Every now and then. Since I come to you, nothing.
Nothing, yes.
So it really works, and I had many, many neck adjustments, and they always help.
Yes, and there are many different ways that I am trained to help someone's neck. For instance, you prefer the manual method. That means done by hand, the traditional method that's usually associated with chiropractic. But a lot of people don't realize that chiropractors are also trained to use other methods. For instance, my table has drop mechanisms that can be used to gently shift the joints of the spine, whether it's the pelvis, the back, or the neck. And we also, well, myself, I'm trained, and many other chiropractors are as well, to use what's called an activator. An activator, you've seen that.
I call it the clicker. You
clicker.
use it when something is stuck.
Yes, that's right, the clicker. So the clicker is known as the activator, and it's been around since, I believe, 1953. And I've been trained to use it. And that's a nice method to use with somebody who maybe is uncomfortable with having their spine adjusted by hand, because all it does is it provides a gentle little click, a very gentle little tap in just the right direction. I also am trained to use the Pro Adjuster, which is that one that taps repeatedly. Yes, that one you can also use for any part of the spine. So I hope you're getting the idea. There are many different ways to adjust someone's spine. It depends on each person's individual body and their preferences. So if somebody's not comfortable with one method, there's always another way to do it.
So what do you do when somebody is afraid to go to the chiropractor? They think maybe it hurts, or...
The best thing is when they can see somebody else who's been and learns from them that it doesn't hurt, that it feels lovely and nice to get a chiropractic adjustment. That's why most people who see me because someone else told them to see me.
True.
Word of mouth, right? It would be nice if more medical doctors referred, but not every medical doctor learns a lot about what chiropractors do in med school.
I hope if you may listen to this show, it would be nice, because it really complements the medical system.
And when you were saying at the first half, when you were mentioning alternative medicine, I don't really see chiropractic as an alternative to medicine. I see it as a complement. I see that if there were no chiropractors, it would be a gaping hole in the healthcare system where people could not be helped in the way we help them. At our office, we also offer acupuncture, done by an acupuncturist trained in traditional Chinese medicine acupuncture, which is impressive because it's a 2,000-hour course. And then we have an osteopath, and you've met her, of course. It's my wife, Monique.
Yeah.
Yes, and we also have 3 massage therapists and 2 other chiropractors as well. Yeah. We're all part of the big team, and many health conditions that people are always going to the hospital for or to their doctor's offices for could be helped if complementary health therapies were used more.
I completely agree. I just shared my story that I went 10 years to the pain clinic.
Yeah.
I got all those interventions. I don't know what they cost, but I figured a whole lot of money.
Yeah.
Now I don't need them no more. So the health system is saving money by me paying you.
Right.
Which I do gladly because it helps.
Yes.
And but I feel many people can't afford it, and it is a shame because they could be helped too.
Well, 80% of Nova Scotians have private health insurance.
Oh, yes.
Yes, that means they have their own Blue Cross, Sun Life, Great West Life, but only 10% of Nova Scotians actually see a chiropractor. The reason why insurance companies pay for chiropractic services is because they know the people who are using that coverage are actually getting more health benefits. Yeah. Some great statistics are people who see a chiropractor for regular checkup preventatively will have on average 300% less flare-ups.
Oh, yes.
Yeah.
I know that myself, and you probably heard many, many stories, and you have a little binder in your office where everybody can read those stories.
Oh, the testimonial binder?
I love that. Yeah, it's cute.
Yeah. Oh, the other part. I didn't even get to the low back, hip pain, and sciatica. That. Sure.
Yes.
First of all, a lot of people will say that will call our office saying they'd like to have help with hip pain. Mm-hmm. More often, though, it's not hip. It's more often SI joint. And you, of course, your anatomy, your medical background, know what that is.
Sacroiliacal joint.
That's right. The sacroiliac joint is where the sacrum and ilium connect together. That's where the end of your spine connects to your pelvis. and that's just below your belt line, and there's one left and one on the right. So if that's the place that hurts, it's not your hip, it's your SI joint.
And the whole body weight really rests on those two joints.
Oh, yes, and they were designed for walking, and most people have to spend too much time sitting, like we're doing right now, right?
Yes,
Yeah,
exactly.
not enough time walking. Unfortunately, those joints love to be walked. They love going for a walk. So
And I always say you have to move your body throughout the day.
And if you can't, if you spend your whole day sitting at a desk, then it's nice if a chiropractor can move it for you. Right?
True. Very
Right?
true.
That helps the nerves. If those nerves are too irritated, not only do you have pain in and around the SI joints, but then it starts to spread further, into the leg, down the thigh, and then you've got sciatica, either from the SI joints or from discs in the lower lumbar spine, the lower back.
So have you seen cases where people were scheduled for back surgery and could avoid it?
Oh, yes, and I've actually I have had patients asked to be taken off the list, which is exciting.
Yes.
Yeah, off the list for hip replacement, off the list for disc surgeries, yes.
Wow, that
Yeah.
is amazing. So what do you yourself and your family do to stay healthy?
Oh, okay, great question. Let's see. I do get regular adjustments. I've gone once a month, but I do prefer twice a month. I find I spend all my day bending over people to line up their spine, and at the end of 2 weeks, I'm ready for a tune-up. I don't hurt. I just know that if I wait a long time, why bother wait till it hurts? I'll get it preventatively, right? I like to get a massage every couple months. I love getting acupuncture, and I do also get osteopathy. Everything I offer to my patients are things that I use myself.
Certainly, certainly. And I heard you talk to other clients about nutrition.
Oh,
so
yes.
you talk about that too, which I think is very exciting because that is a big part of what I do. And we
Yes.
talked many times about nutrition ourselves. And I like that you also educate people about that aspect of healthcare, which is so important.
Oh, yes. I'd love to fill you in on what I do supplement-wise, for instance.
Yes.
Yeah. Well, I do take omega-3 oil every day, and I take vitamin D every day, and I take probiotics every day. These three things I wouldn't go without. They're things you can't get easily in your diet.
I agree.
The omega-3 from fish, if you ate enough omega-3 fish, you'd have too much mercury. Vitamin D from the sun, if you get enough vitamin D from the sun, you get skin cancer. What's the third one? Probiotics. If you grew your own food and had, healthy manure spread on it, yeah, maybe. And if you made your own kefir and your own sauerkraut and your own, all these fermented products, you
Yes.
could probably get it from your diet. But
Yeah.
for convenience sake, I do take a probiotic supplement.
Wonderful, and I know you sell a few of the the better ones in
Yes.
your office.
Yes.
And I know that you eat healthy. You get pastured eggs from somebody that has backyard chickens.
That's right, from you. Thank you very much.
Yeah,
Yes, which reminds me, I ran out this morning. So, and you're not in until tomorrow.
tomorrow. Yeah.
So I've got nothing for breakfast tomorrow morning.
Oh,
I'll have to eat some department store eggs for one morning, I guess.
Yeah.
Yeah.
get free run eggs. The second best. Pastured is even better, but free run is second
True,
best.
true.
Yeah. No, what else do you like to eat?
Let's see. I like to try to eat I like to eat a diet that doesn't have too much starchy foods in it, for instance. If I'm thinking I might eat some bread, I'll just have some vegetables instead. I try to increase my vegetables that way. What else? Vegetables.
You told me once that
fruits.
you tried a ketogenic diet, but you can't do it because you lose too much weight on it.
Yeah. I wanted to experiment with ketogenic diets to
Yes.
see just how powerful it could be as a weight loss tool. And I felt great. I had lots of energy, but I was losing weight really fast. So I had to stop. I had to reintroduce a lot more carbohydrates. So I do eat my organic oats again, and I'll have some. Actually, I love kamut pasta. It's made in Canada too. It's
Yeah.
great.
I make my own bread out of red fivey grains, organic, non-GMO.
Right.
Amazing bread. I have to bring you some to try.
Absolutely.
No, for people that are not wheat sensitive, I think that is an alternative.
Yeah.
But there's lots of allergies going on, and I think chiropractic might even help them with allergies, does
Well,
it?
I think if you're wheat sensitive, even if you're not wheat sensitive, I think there's just too much wheat and dairy in everybody's diet.
Mostly, yeah.
And we could
Yeah.
go a day or two without both those products and still
Yeah.
be really extra healthy, I think.
I agree. It depends very much on the dairy. That's one of my favorite words. Is Depends. Because the
you're able to
organic
find some-
dairy
yeah.
from a grass-fed cow,
Right.
especially if you get it raw, would be nice. It's not legal in Nova
Not in
Scotia.
this country, but you can get raw cheese.
Yeah, you can get raw cheese. You can
Yeah.
get real cheese, not the cheese whiz that I always go after. I say in one of the shows, when it doesn't rot on the countertop, it's not real food.
Right. It
And
has to
not
be
even in the
alive.
fridge. And cheese whiz you can keep forever. It's pure plastics.
Yes.
And I think that's a nice thought to finish, that chiropractors help you with your spine, your nerves, your pain,
Your nutrition,
and general health.
exercise recommendations,
Yes.
stretching, lots of
Excellent.
good healthy advice.
So everybody should have their own favorite chiropractor. I'm happy I do.
Thank you,
And
Christine.
this brings me to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Dr. Glenn, my email here is Christine, Christine, at communityradio.ca. And I'm always grateful for feedback. I also wanted to extend a special thank you to today's producer, Juan Goyash. Thank you. And you might not know this, but this is a volunteer-run non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thanks, Dr. Glenn, for being on the show.
Thank you for having me.
Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon at 97.5 CIOE FM, Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.